Would it surprise you to know that nearly half of adults in the country have elevated blood pressure, and most don't even know it? Yet only 30% have spoken with a healthcare professional about the adverse effects some over-the-counter medications can have on their blood pressure. Joining us now to discuss this is the American Heart Association's Chief Clinical Science Officer, Dr. Mitch Elkind. Dr. Mitch Elkind, how are you, sir?
I'm great, thanks, and thanks for having me and the Heart Association today.
It's a pleasure. So why is it important for patients with hypertension to know that their numbers are regularly self-monitoring blood pressure?
Well, we've thought of high blood pressure and hypertension as being the silent killer for many years. And that's because people often don't know that they have high blood pressure until something catastrophic happens, like a stroke or a heart attack. And so we think it's important for people to know their numbers, to get their blood pressure checked regularly. And if the numbers are elevated, then talk to their doctor about it. And it's so easy to do that now. You can get your blood pressure checked at a doctor's office, but you can also do it at the gym, at a pharmacy, or even a kiosk in a local grocery store. So know your numbers and get it addressed as necessary.
Why is it essential for people to work closely with their healthcare professional before using over-the-counter medications?
So we've learned that some of these over-the-counter medications, although approved for general use, may contain certain risks for people who have high blood pressure in particular. So especially the over-the-counter pain medicines like the non-steroidal anti-inflammatory drugs, or NSAIDs, can raise blood pressure, especially if they're taken for a long period of time. And we know that half of Americans do take over-the-counter pain medications. So those are concerning. And also some of the over-the-counter cold and flu remedies can raise the blood pressure. And so before taking a new medication, super important to talk to your doctor about it, make sure it's safe for you, or what an alternative may be instead that will have less risk of raising that blood pressure.
Is there anything that our viewers can do to check for themselves when they're in at the, at the pharmacy for what is and what shouldn't be taken, or what some of the over-the-counter medications they need to look out for that can elevate blood pressure?
So for pain medications, it's those NSAIDs like ibuprofen, naproxen that have more of the risk. A safer alternative might be acetaminophen, which doesn't seem to have that same impact on blood pressure. And for the cold medicines, you'll notice in the pharmacy, in the aisles that we walk in the flu section, that there are some that are labeled as not being safe for high blood pressure patients and others that are. And that's because they remove the stimulant that drives the blood pressure up in the ones that are better for blood pressure patients. And so that's what people should be looking for, I think. But again, always important to talk to your doctor first.
Those numbers we mentioned at the beginning for people being aware of their own high blood pressure, why do you think those numbers are the way they are, and why aren't more people self-aware about going and visiting with their providers?
Well, a lot of people don't have doctors in this country is probably one of the leading reasons. And then a lot of people who do have access to physicians don't necessarily see them. Many people don't interact with the healthcare system until they have an emergency, and then it's suddenly discovered that their blood pressure is elevated, and then it can be addressed. So it's a lack of care, and access to care is important. And we know that there are also more people with high blood pressure, probably because of the fact that we are facing an obesity epidemic. 70% of the population is obese or overweight, which can also drive up blood pressure levels. So it's a combination of factors that really does it, but all the more reason that the Heart Association is out there trying to push this message, because this is the best way to prevent heart attacks and strokes.
And that message is important. And where can people go to learn more information about your organization?
Yes, please come to the AHA website. It's heart.org, so it's easy to remember. And specifically for information about blood pressure, it's heart.org/BP Tools, the BP for blood pressure, of course, so BP Tools.
Doctor, thank you for your time this morning. As he mentioned, to learn more, go to heart.org/BP Tools.